How are you?
Good evening. I'm fine, thank you. I can talk somewhat, and that I cannot. I'm going to ask Michael to do most of this presentation, but I'm certainly happy to answer questions as we get to that part of the presentation. But for now, I'll ask Michael to go over.
Okay, Mike, go yours.
Good evening, freeholders. I think if we don't mind, let's go to the last page. I think that would be the better idea of what the budget looks like.
Sure.
So as you can see, our total budget is down $1.1 million, but significant to look more closely at the salaries. The salaries are down almost $4 million. In addition to that, the fringe benefits that are not budgeted in our cost center, it represents another 52% of that. So when you add in the factor of the $4.5 million worth of salary savings and overtime and regular salaries, you're talking about a total of over $7 million from 2012. Yes, the other expenses are up because basically the services that were provided last year by county employees and police departments are now being contracted out. So really the savings, when you include the overtime and when you include the fringe benefits, is approximately $4 million from what it was this time last year. We'll go back to the first accomplishments. One is, as I mentioned earlier, you can see on the third bullet point that we've reduced the staff from 548 FTEs to 427 as of December 31st. As of today, we're down to 408 FTEs.
408.
Eight. We also have about 34 vacancies, of which we're freezing all but the most essential for 2012, which will save, which is included in the budget as $1 million.
For 2013.
I'm sorry, 2013. Thank you. We have just positions in nursing that we're asking to be filled on an as-need basis. If there is a need for it because of a family leave act or because of the overtime tends to spike up, we want to have the option to fill a position, or if the occupancy goes back up. Right now, we're still struggling with 250 patients in long-term care. Traditionally, we've been at 275 to 280. We've made some strides in the last several weeks. It's bumped up about 5 to 10 patients. We'd like to get it back up to that 280 number. Significant because the 30 additional patients on an annual basis brings in about $3.5 to $4 million for revenue standpoint. The other, I guess, the other initiatives that we can go into our accomplishments. Pretty much what we've done is besides that, we continue to provide flu vaccinations. Our medical director is involved with the Union County Links program, and we've been trying to market the facility by going out to health fairs as well as providing information to the citizens to try to sell Runnells Hospital. A lot of questions people ask, is the hospital for sale? Until no decision has been made, we're trying to stress the care of the facility. We have, as I said, seen an uptick of about 5 to 6 patients over the last month in our subacute unit. That's important because that is our biggest pain next to the site. So we're hoping that that might be a positive and that we continue to see an increase in the subacute population. That will be more money coming in if we continue for the rest of the year.
I just would like to comment on that. The good news in the uptake is due to the fact that we've signed a contract with the Summit Medical Group, and they're now accepting their subacute patients that they're transferring from a hospital that require post-acute subacute care. We signed the contract with them early February, and we're now seeing a regular increase after having negotiated that with the Summit Medical Group.
Does that have any particular numbers associated with it, or is that just as on an as-needed basis? That's what those folks would be referred to.
Well, we actually do is we gave privileges to they have a new geriatric physician that they hired. And as a result of that, it's not really signing a contract with the organization, it's giving privileges to the physician, who then refers his patients that overlook, or at the Summit Medical Group in some cases, directly into our facility. They were very impressed when they came out to visit last year, in the last quarter with the facility. They liked the idea of maybe opening up a separate unit. We'll discuss that as one of our initiatives, that we can have a more younger orthopedic driven group of patients. who are looking to be closer to the rehab section of our facility. Basically, it's the one east unit that was closed several years ago. Those beds are a little bit larger. They offer semi-private accommodations in the sense that a bathroom is located in each room, as opposed to long-term care. 2 rooms share a bathroom. So 4 patients are utilizing 1 bathroom in long-term care, as opposed to 2 patients utilizing a bathroom in the one east unit.
And as important as that is the room is at least 2/3 larger. That unit was built to med-surg standards, not to long-term care standards, because they were licensed as acute care med-surg beds when the building was built. And they're very interested in moving in that direction to have a younger rehab unit there.
We wouldn't change the total population of license of 300 beds. We would just take some of the existing beds on 1 West, which is the long-term care, and convert them from being a double occupancy to a single occupancy. But again, they'd be sharing a common bathroom between the 2 adjoining rooms. With the combination of those 2 units, we could still have 60 beds on the 1st floor. Combined with the other 240 beds on the 2nd and 3rd floor would still be our licensure. The expense would not be that great. It'd just be doing some painting and some upgrading, some new beds, probably less than $50,000 to have it up in operation. And it seems to be the trend that a lot of other facilities are going towards, offering these amenities, so to speak. You're not getting more money, but you're attracting people because they feel they're getting something for their dollar, be it their insurance dollar or their personal dollar. Want to go to the initiative? 2014. Again, as I mentioned, we're looking to improve the occupancy. We have additional staff going out to the hospitals. We have another assessment nurse who's going out who had prior working experience with one of our receiving hospitals. She knows the people that basically send us the quality patients. She has a good rapport, good personality, and she seems to be having some success. First, making people feel more comfortable about our facility again. That's important to establish Runnells back as being a facility it always was, and to start attracting more patients and more subacute unit. Because not only is our subacute unit important, but also many times people are unable to go home. We become possibly the first consideration for long-term care. It becomes a feeding section for the 2nd and 3rd floor when we have openings on the 2nd and 3rd floor. So that's one of our strong initiatives that we're trying to put through in 2015.
To open that, we must petition the New Jersey Department of Health for permission to open the 1 East unit to make it a younger rehab unit that we'd like to be able to do. But we must petition the Department of Health to do that because we closed those beds when we closed our physical medicine and rehab unit.
We don't see a major problem with that. We did utilize that facility 2 years ago when we refurbished the 3rd floor, and residents from the 3rd floor were moved down there in groups of 20, while sections of the facility were redone, and the state had no problem with that. So basically, we're doing the same thing. We're saying that we're rehabbing the 1 West side and trying to make it more accommodating to the patients who are coming in. As long as we don't exceed our 300-bed licensure, we don't see a difficulty, because they will still be considered long-term care beds, regardless of their appointments for 1 West.
Girls, questions? Is it appropriate, maybe this is more to Frank, there was some conversations in terms of expansion of the site, or any other, I don't know, Mike, I know that.
I think maybe, if I may, I think maybe we can give you an update on probably where we are with trying to recoup some of the money, and then talk about.
Okay, I had it backwards, but we can do that.
Whatever you want to do.
Let's talk about recouping some of the monies that are owed us.
We have been in dialogue with Middlesex for the last 2 years, and we started
And the department.
And Department of Health over a year and a half ago. County Council Barry and his first assistant Mona Albert have been quite helpful in trying to resolve some issues with Middlesex. They have made some payments, but they've been slow in making them. They still owe us over $1 million. that really basically covers 2010, 2011, and 2012. Our other concern is the fact that they're making reductions to our billing, and we're waiting for documentation as to the reason why. In the past, it was a small amount of money that was justifiable because maybe the patient wasn't a Middlesex patient. But now it's 6 times greater than what it was. When it was $25,000, it's now $175,000. Our bills are approaching close to $750,000 a year. So you can see the discount or the reduction. And besides, as I said, we did get paid the end of December for 2009, and we got partial payment for 2011 and a few months of 2012. They have been billed through December 31st of 2012, and we are awaiting documentation as to when they plan to pay us the remaining balances. As I said, it's on the high side of $1,000,001. If you take out their discounts, it's still over $800,000. Coincidentally, in 2013, our rate goes up. We have finally reached the low of the roller coaster, and the rate is going back up to $907 a day. So their contribution will be 15% of that. Middlesex County, the state paying 85%, or anybody who's a county resident of Middlesex. Based upon the population, which is now roughly 50% Middlesex versus Union County and a few other smaller counties, we project that we're approaching $950,000 on an annual basis based upon this new rate. We're hoping that some dialogue can be resolved. Because there's issues that need to be addressed not only on the payment, but also the entire process. They did not send an investigator up, so many times they wait until the patient has left our facility, that they're homeless, they cannot be found, and they're then saying that the patient is fully responsible because the patient did not fill out the proper paperwork. Even though the patient is eligible for Medicaid, we've demonstrated in the past that the patient has been declared indigent. They're utilizing works in the law that says if it's more than 6 months, they have to reevaluate the patient. We feel that that's not fair to the patient, it's not fair to the county of Union. And so we're having the state also to meet and see if they can work out some kind of arrangement.
And certainly what was frustrating when we heard about all this is that we're required to take these folks in.
Oh, yes.
We front the money, we pay for their care, and then we're still 2 to 3 years in arrears in terms of getting, I mean, we provided the service as we're required to do. And here we're still, then we have to fight the state of New Jersey and the counties, the other counties for those dollars.
Yeah, unfortunately,
It's just unbelievable.
We don't have an arrangement another county has whereby the state pays them up front. They go
Oh, we know that.
Yes.
That's unfortunate for us.
Yeah, I mean, that would be a good deal.
We would love that.
I understand that, but I mean, that's,
But
like I said, it's frustrating because it's certainly not anyone's fault, in terms of that. I mean, these are reimbursements that, basically the state has to provide. I mean, they just they require you to take these folks in, provide the care and everything else like that. And then when it comes to paying, they don't provide the money.
And coincidentally, Middlesex always under budgets within their annual budget the amount that is due to other counties. So then they come, I guess, a budgetary transfer at the end of the year to put the money into the prior account.
But I mean, I don't know, Frank, if you want to, if there's anything else you want to comment in terms of, we talked about possibly expansion or other.
Just obviously.
I know the state is going to do that.
Well, obviously, the board, it was clear from the finance committee meeting that we shouldn't explore anything until we resolve.
So we get paid, right?
Exactly, and we've diligently tried to attack that end of it. But there is an issue statewide relative to these types of beds, with Hagedorn closing down, with other county nursing homes closing down, had a psychiatric attachment to it, and with Camden looking now to close. There is a need statewide for these types of beds, and we will obviously, the state has contacted us on a couple of occasions, and we will explore that, based on what, overall discussions that we have here. But our first and foremost concern is getting paid for what we're owed, and then we'll
I
come back to
find it's certainly ironic that here's the state perhaps asking us to take more people, so we're supposed to take more people that they will pay us for, as opposed to the fewer people that they will pay us for. So, and especially when they have, as we should say, as various places have closed, and the pool of available beds shrinks, you would think they would be much more cooperative in terms of writing the checks that they're gonna write anyhow.
And
That was only,
the state monitors the vacant beds in the facility, so if we refuse to take Middlesex patients, and we have vacant beds, they would force us to take them.
I know, that's, I mean, like I said, when we heard all that we forced to do that, and still not being paid, I guess, beyond what we can. Any other questions? Gentlemen, ladies, Fielder, Paul?
You spoke about someone who's promoting Runnells, and I'm figuring that probably this person or someone is probably reaching out to the regional hospitals for referrals for subacute, because it's been my experience with some of the seniors encountered in the last few years that they're in the hospital, but the social worker doesn't always know that Runnells is available to give them the kind of care they need, and so we can work on making sure that our regional partners are aware of what we offer, up some of those referrals.
We're doing that. We're working with our largest referrals overload, and then we plan to expand out to other hospitals within the county and also joining counties. So that makes Somerset and also Morris with the Morris County work. But right now, Overlook is our largest feeder, and the rapport that we have to establish with them again to show them take care of the patients. That's really intentional over the last month. Because some of the success we've also expanded on that goal for the future.
We have been all year attending health fairs and going out to meetings with seniors to discuss the care of Runnells. But I have to say, the articles in the newspaper were deadly. They truly were deadly. And I get calls as the administrator most days. Are you still there? Are you going to be there? What's happening with you? I want my mom to come there if you're not going to be there. And I say, no decision has been made. We're still providing this care. And that really is an issue for us now to increase our occupancy. It truly is. We've not reduced our efforts to market Runnells, but I think that having read what they read in the newspapers, which is all true, but at the same time, it does impact on our ability to admit residents to the facility.
In addition, postings on Facebook are now common, so it's difficult to even counteract that because unless you know what you're looking for, sometimes we had people posting that we had contracting out of the 3 services that we actually reduced the staff, but we had no staff to provide those services. So we gave the impression that 150 people were less at the facility, unable to provide the services. So we have to counteract sometimes not only the articles in the general media, but also in the new media or Facebook.
Anyone else? No, Mike, thank you. Joan, your last budget here?
Yes, it is, sir. My pleasure.
I'm sure that's a great relief.
My pleasure.
Thank you very much.
Thank you.
All right, human services, the last